First of all, I would like to thank each and every one of you for taking the time to attend this presentation and for giving me the opportunity to collaborate by sharing not only the information regarding anxiety, reframing, grounding, and mindfulness, but also to share with you a little bit about myself now that I am working with Connection Wellness Group. So, with that being said, let me go ahead and share with you some information about my background. After starting with Connections Wellness Group as of September of 2022, prior to that, I worked for Denton ISD for about 13 years in a school setting. I used to be the social worker at Denton High School and Geyer High School. And then for those schools that are the feeder schools into those high schools, I provided services there. So I applaud you. I understand you, and I am very, very thankful and grateful that we are together now. Now that I'm working for Connections Wellness Group to discuss mental health. So my name is Martha Valles. I am a school social worker, and I worked for Denton ISD, as I mentioned, for 13 years, and I've been in practice for 14 years. Now that I am at Connections Wellness Group, I thought you should know that when I go and I deliver some discharge plans and safety plans for some of your students that have received our services, I have had the opportunity to sit in some of your lobbies while I'm waiting to see a counselor or I'm waiting to see an administrator. And I had the opportunity to read your magazine, The Loop. And it was so fascinating to me that you had an article there, excuse me. And the article really caught my attention because I, for one, am a bilingual student, former student, obviously, of the schools that I attended over the years. And I noticed that the publication stated that the emergent bilingual students were biliterate, bicultural, and bilingual. So please know that I took that from the magazine and I carry it with such honor. Um, I am so happy to also relate to you that I am involved with community engagement and collaboration. So I am the social worker that is the clinical liaison at Connections Wellness Group here in Denton at our main headquarters. In the areas that I go and I provide services and I serve students and families are in the Argyle ISD, Decatur, Crum, Lewisville, and Ponder. So, as we all know, we try to also um, encourage students to maybe try that venue of higher education, which is why I put in my introduction that I wanted to let you know that I started my school years in Mexico. I'm originally from El Estado de Coahuila in Mexico. And when I moved to Texas, I went through the school system and I learned the language. So I am so thankful to you as instructors and administrators in school districts. I also attended Denton High School, and afterwards, in years later, I am the non-traditional student who went to Texas Women's University and got my bachelor's in social work, and then shortly after went to Texas A&M Commerce to get my master's degree. So that's a little bit about my background, just in case you were wondering who I am and where I've been. So um, the agenda that we will be following is quite simple. We will try our best to get you done before an hour and a half, the most. We will be covering and jumping in discussing uh, the topic of anxiety, and some of the things that we will also be doing is an overview regarding anxiety, the reframing, the grounding, and the mindfulness. We will also learn about how to identify some of the physiological responses to anxiety on the body. We will gain a better understanding of anxiety and the brain. We'll discuss some coping strategies. And at the end, as Amber was saying, you are more than welcome to leave some questions in the chat. I apologize. I will be honest with you. I don't think I'll be able to keep up with those questions as I'm going through the presentation. But at the end, if you would like for us to go over, and we do have time to go over some questions, we will gladly do so. And if I don't know the answer to your question, I will not pretend. I will be more than happy to find out for you, and we'll get back to you to give you the right information that you are seeking. So, with that being said, let's go ahead and move forward. So we will be going over these definitions, not because I believe that you don't know what fear is or what anxiety is or stress or worry or panic. It's only because we want to make a clear distinction of what these feelings are, especially because we'll be discussing not only how anxiety affects our children, but also adults, and just to get some very basic understanding that these are the feelings or emotions that when someone is experiencing some anxiety may be encountering. So as we know, fear is something, of course, that we detect as an imminent threat, something that is scary. We have a reaction, and it mobilizes the organism by triggering a psychological change. Anxiety, as we will discuss, is an emotion that characterizes apprehension. There's this anticipation of something dangerous that will be happening, or something like a catastrophe that may be coming our way, or a misfortune. And we have this feeling of something that we're not sure is going to happen, but there it is. And then stress is something, of course, physiological and psychological. It's a response for the stressors. The stressors can be internal or external, and it involves changes in the system. Our entire body feels it too. Sometimes we feel it in our body and our areas where, it could be different ways, our muscles or in the back, and so on. Worry, if you know some people or some individuals who constantly worry about something, there's this mental distress. There's this way of agitation due to a concern, something that they're anticipating of an event or a threat or something that they may consider dangerous. And then lastly, panic. That is something that is so, and it can be sudden, uncontrollable, and it's a reaction that may involve some terror, some confusion, some irrational behavior sometimes. And it's something that they perceive of some kind of a threat that is heading their way. So with that, why are we going to go ahead and focus on anxiety? Well, we're actually very fortunate now to be able to say that so much research is being done and conducted within the area and the scope of our brain, that we are, at least in my opinion, is that we are now having these open discussions more and more frequently about how our brain works and how our brain is impacted by emotions that we feel. But with that, anxiety is going to be the key factor today. So, anxiety is very typical. It is a human reaction due to stress. But anxiety is something that we have in our nervous system, and it's quite natural. It's a way of us preparing for an escape in case we are encountering danger. Uh, that's not bad. Therefore, the anxiety could also be something that prepares us on a day-to-day basis in our lives. Uh, when we're driving, sometimes without even knowing, we brake. We don't even realize that there's there's something there that could have caused us to have a wreck, but our system is so quick and the reaction is so quick that we're able to stop without even realizing how did that happen. And our heart is palpitating, and we may even feel a little nervous and jittery, and we're like, oh, did I spill my coffee? Am I still going to make it to work on time? uh, but anxiety is something that is natural, it is normal, but for some, the anxiety levels can become unhealthy, even debilitating. And when anxiety starts to affect our daily functions like that, that's when it becomes a problem. So, some of the signs and symptoms of anxiety, and we will be discussing many of these, are, and I won't go one by one, but we will be able to identify some of these. I think it's important that for those of you that are teachers, coaches, instructors, and if you're a parent, think about your child, whatever age they may be developmentally, as you observe them and you kind of get a feel of what your student is like. Sometimes you start noticing things. And as a parent, you start noticing probably a little bit faster because you're there more than we are with your child. And these are some of the signs. They may experience inattention, poor focus, some crying or tantrums, constantly seeking reassurance, maybe with a clingy behavior. They may have some difficulty falling asleep or even staying asleep, some agitation, fidgety or restless. Some may even be chewing their fingernails or, tugging at their hair. There may be an excessive shyness, unusually fearful of germs or becoming ill. There's also some repetitive behaviors with some individuals, like constantly hand washing or counting. And then they also notice and they do and follow certain patterns. Um, some may have difficulty making friends, or they are having difficulty participating in group activities. In some cases, not all, one or both parents tend to be anxious. Physical symptoms, and we'll discuss other kinds of symptoms, but for right now, let's talk about the physical symptoms. So, what are we observing? Increased heart rate, shortness of breath, chest pain or pressure, a choking sensation, maybe lightheadedness, sweating, hot flashes, upset stomach, maybe nauseous, trembling or shaking, some weakness, unsteadiness, faintness, tense muscles, rigidity, dry mouth. Cognitive symptoms. Well, they may fear of losing control or being unable to cope. They may fear physical injury or death. Also, fear in the term of going crazy, fear of negative evaluations by other. And by the way, when we think of evaluations, let's talk about grades when they're taking quizzes, exams, and trying to prepare for maybe even trying out for a team if they're practicing a sport, or if they have extracurricular activities. They may also be worried about those things and they're frightened about making the team or not making the team or that part of the group. They have frightening thoughts, images, or memories. There's a perception of unreality or detachment. There's poor concentration, confusion, and distractibility. There's this poor memory, possibly not remembering what all they have to do. Now, if you're a teacher, and I know and I trust that you have everything online and your students can look up every assignment that they must complete, if there's nothing that's considered a surprise, every quiz, every assignment, every day that they go to class, but they're still having, poor memory in completing their assignments. It may not be poor memory because they forget to do the assignment, it's keeping it all together. Maybe even getting to the point of checking to see what all they've completed, what all they still have missing, and then asking you for reassessments if they need to reassess. Those are only a couple of thoughts that come to mind. Behavior issues. Usually, in my case, when I used to be in a school setting, I would get the email or a phone call, and it could have been from a teacher, a coach, an administrator, sometimes the parent who was concerned about a behavioral issue with a child or with a teen, an adolescent, and they were seeking, some support and information as to what can I do, or can you talk to my child? But you may notice some avoidance, and they may also escape. Well, how does that happen? Well, you may observe that your student may not be going to your class, and instead you find out that they are spending more time in the hallway or in the commons area or in the bathroom. So they're avoiding getting to your class, they're escaping. They also feel restless. There's some restlessness. They may be agitated. You may notice in the behavior while they're in class that anything sets them off, and they're not cooperating maybe as they were at the beginning of the school year. Now here we are, second semester. We just started the second semester, and you're hoping maybe your student will experience a more positive day or semester in this school year. But you begin to notice that maybe there's still that agitation taking place. They may not be able to sit down for long periods of time, and you're constantly having to remind them to take a seat, to have a seat. Um, you do have those cases where you may see the hyperventilation. I can't breathe. They may even freeze and be motionless. There are cases also of students who become so motionless in the sense of having difficulty even to express what they are wanting to say. Now, there are some severe cases of some selective mutism, but that's not what I'm referring to. I'm just saying putting together, just getting a message across to the teacher or to the parent. This is what I'm feeling. They may not be able to even verbalize exactly what they are feeling. Emotional symptoms. So what do they look like? Well, they may be nervous, tense, wound up, feeling frightened, fearful, possibly even terrified. And you may be asking yourself, so are they in danger? Not necessarily, but it's a feeling. And we are validating what someone is feeling. We cannot minimize it by saying, oh, get over it. You're not in danger. You're not really, you're making it up. They are not. What they are feeling is true to them. They may be edgy, jumpy, jittery, impatient, and frustrated. What about those students, or what about those individuals that have or experience anxiety but are high function? What do they look like? You may already know because you interact with them on a daily basis also. So, what others see is, well, that person's always on time. And these are only examples. And the individual who's experiencing the anxiety and those thoughts that go through their mind is saying, well, if I'm late, digestive issues and feelings of panic occur. On the other hand, we may even say, well, that person is so organized, they got it all together. But that individual may be saying, but if I'm not organized, I feel so overwhelmed. We also think, wow, accolades for days, and they will say often coupled with high stress, worry, and fear. And you may think, wow, that person knows how to take charge. But that person who's experiencing it says, need to feel in control to avoid anything going wrong. And what about those cases where we're like, wow, that person is always so helpful? And the individual may be thinking, well, that's because I'm too worried of what they may think if I say no. Also, what if they're so calm and composed and everything looks just peachy and perfect? Well, guess what? Probably they cried earlier in private. And these are some of our kiddos in school and adults. We've all experienced something at one point in life. This may sound familiar, some of the things that we're discussing. Wow, those were a lot of symptoms, you may be thinking or saying. Why? Why even go there? Well, it's important for us to discuss all these symptoms because symptoms are just that, symptoms. They are small, external piece of a much larger internal picture. And haven't we been in a situation where maybe from afar we think we're looking at something, but as we near and get closer, it's focused and we see the context and we see everything and it makes more sense. For these individuals that I was describing, and some of them we may know personally, and if we don't know anyone, and if we are not experiencing anxiety, but we are here today learning about all this information, I applaud you because what a way to go ahead and learn something that we may be able to utilize later and do it as a preventative measure and help someone else when the time arises. As we were saying, or as I was mentioning, all these symptoms, they are just that, symptoms. But they're so real to the individual that is experiencing these symptoms day in and day out. And it could be just recently, or maybe they've been experiencing this for quite some time, but not even know that they are experiencing anxiety. For one thing, if they are going through all these symptoms, they have a fear of letting guard down. Because that's one thing about having all these symptoms. They're constantly prepared for something that is happening, or they perceive that something may be happening, something may be going wrong. Wow. I know you're thinking what I'm thinking. That must be exhausting. And it is. Nonetheless, they figure out a way to move along and cope with that exhaustion. But they are ready for change once they understand and it becomes something more knowledgeable to them that change is possible because these symptoms that they are experiencing hold information. There's a reason why they're experiencing these symptoms. Before we jump in any further about maybe dissecting a little bit more about how to decipher, what to say or think about symptoms, let's talk a little bit about anxiety and some of the research that has been conducted and what's been reported. In 2018, there was an article published, and it was published in the Journal of Pediatrics, and it was regarding prevalence and treatment of depression, anxiety, and conduct problems in U.S. children. And it was estimated that 25% of all teens struggle with symptoms of anxiety. 25%. But 7% ages 3 to 17 have been diagnosed with anxiety disorder. And that is about 4.4 million children and adolescents. 2 years later, after the onset of COVID-19 in 2020, there was a survey that was conducted, and it was regards to U.S. high school students. And it was found, and this is adolescence and the anxiety symptoms, and it was discovered in 2020 that 9.2% of the kids had been diagnosed with an anxiety disorder. And that's about 5.6 million students or children. Now, with that being said, 2 years earlier, it was 7%. In 2020, it was 9.2%. Now, we will all agree that experiencing and going through COVID-19, as we currently still are, has changed everything. What we consider to be normal in the past will no longer be. We have a new sense of normalcy. Anxiety still is in existence and is in the rise. 47% of females and 21% of males reported moderate or severe anxiety symptoms. 1 in 5 people will struggle with an anxiety disorder over the course of their life. Now, 58% of teens say they are not getting enough sleep. Now, people with insomnia are 17 times as likely, more likely, to have diagnosis of anxiety. What does anxiety in childhood and adolescence look like? Well, anxiety is a normal part of childhood. Most children go through the phase of anxiety, as we know. When children are little, and when I speak about developmental stages, let's talk about toddlers or babies. When you take them to daycare, you will begin to notice immediately that separation anxiety of, oh, I've been with mom and I've been with dad, and why am I staying here? There's that anxiety. But as we know, that ceases. There's a healthy attachment with the parent, and the child knows that the parent returns every day. Children also experience anxiety when they start going to preschool, or they start going to school, or let's face it, when they move to a different school. Anytime you move, there's this hesitation of, how is that school going to be for me? And I am going to be making new friends. Puberty. Puberty is definitely a situation where teens will experience many physical changes associated with puberty. Females are more likely to experience stress, and those that are going through puberty, the adolescents, also experience this fear that, what if others find out that they're having this difficulty concentrating in school, or difficulty feeling like they belong in that area, and they have hesitations and thoughts that worry them and cause fear, and all those emotions that we were discussing. These phases that some of the teens or adolescents experience are generally temporary, uh, but nonetheless, some do not go away. Anxiety is something that more often girls or females are diagnosed with. And ADHD is something that boys or males are often diagnosed instead of anxiety. So, what are the risk factors for anxiety? Um, well, actually, that's an excellent question. And it's been found, like I mentioned, that gender plays a role. Females have a greater likelihood that they will be diagnosed with anxiety. At age 6, it is twice as likely to have experienced anxiety disorder than boys. Temperament or poor emotional regulation can also be another factor. There's negative emotions responses for that are more frequent and intense. The children that have that will, and they have a risk factor of possibly experiencing more anxiety. This was something also that I found, and it's in reference to parents, that I found interesting, because it says, and it doesn't mean that all parents who have anxiety fall in this criteria, but for some, anxiety disorder increases the risk in the kids. And if the parents are experiencing and they've been diagnosed with anxiety, for some parents, their anxiety disorder can increase the risk in kids, because the parent symptoms can impact the relationship with the child. And you may be asking, well, how can that be possible? Well, if the parenting behaviors are at risk factors, it could be like overprotection, controlling, maybe rejection, or possibly lack of warmth. Life's adversities or trauma can also cause and be a risk factor for the cause of anxiety. I personally can tell you that it touched home when I read out loud to myself that the parental loss can cause a great deal of anxiety. Not that I thought that it wouldn't, but I am currently raising my grandchild after my daughter died in a in a fatal car accident unexpectedly back in 2014. So I do try my best to remember that, grief and loss is forever. It depends on a daily basis what kind of day we're having. So we've made it a point to ask ourselves, how are you today? So learning and also reminding myself uh, to say it out loud that if a child experiences a life adversity like the loss of a parent or a guardian or a loved one, that we must always remember to check up on them just to make sure that they're doing okay. What about adolescents? How does anxiety present? So the fidgeting, the nervousness, the shortened attention span, inability to focus, irritability, withdrawal or isolation, verbally acting out, fear of missing out. All of this sounds very familiar. I know I'm preaching to the choir if you're a teacher, if you're an instructor. If you are a parent, I know that also as a parent, we worry. What is going on? Why can't I get my student, my child to concentrate and do their work? What is going on? I just want them to go to school every day so I don't get calls from school letting me know that my daughter or son is being counted absent again, and we could possibly end up in truancy or with truancy situations. As a teacher, you just want your student to be okay, to come to school, complete assignments so you can grade and also know that your student is advancing. After all, isn't the goal for your student to graduate from school, whether it's elementary, middle school, and then high school? That's what we all want. But if our kiddos experiencing all of this, maybe lack of motivation, I can't tell you how often I would hear, he's just not motivated. I can't get him to do A or B, much less come and complete the work assignments that he hasn't submitted since last 6 weeks or last 9 weeks. The inappropriate or exaggeration that they may even act out, anxiety, that could be the cause. Also, for some students, and I am sure in our audience we have some counselors, also crisis counselors, um, as social workers. Also, we would often address, and we continue to address, situations where we know there's some self-harm behaviors. We are very fortunate that in our school district, including Lewisville ISD, and I am very happy to know that we have one of the best. We are there to support our kiddos. We are there to support our families. We are there to find ways to see how we can motivate them, but most importantly, how to keep them safe, how to give them a safe place to talk, and then how to guide them so they can receive what they're needing to do and feel better. Anxiety and depression are often co occurring conditions. About half of those diagnosed with depression are also diagnosed with an anxiety disorder. Wow, I know that's a lot of information and some of it sounded grim, but there is some good news, but there's also some bad news. The good news is that anxiety and depression are treatable with excellent recovery rates. That's wonderful, and that is great news. The bad news is that it is estimated that 80% of kids with a diagnosable anxiety disorder and 60% of kids with diagnosable depression are not, and I repeat, are not getting treatment. There's much to be said. I did not do more research so I could present to you as to why, but that is a very important question to ask ourselves. One thing that I'm very, very happy to see that we are doing today, which is definitely a move in the right direction, is that we are working together, we are collaborating, and we are talking about mental health. By doing this, we are trying to break the stigma within relation to pursuing help regarding mental health. So that is a move in the right direction. But let's get practical. Children and adolescents benefit more from physical and visual interventions than they will from talk-based interventions. And let me just explain just from my perspective, and I'm only sharing, I'm not saying that I am right, but I will share this with you. As a former school social worker, I would interact with high school students, middle school students, and uh, kind of seldom with elementary school children. But oftentimes I would find that it would have to be very quick because their attention span was very short, and they more than often wanted to be on their device meaning their cell phone, which they find hard to separate from. And I cannot compete with an amazing TikTok video or an influencer or someone that they're looking through Snapchat, because they're on the they're on the move, they're on the go, and it's all about social media. So something visual, something that they can hear is often um, debatable. Which one do they prefer? Well, it's not going to be talking to me or another adult for a lengthy period of time. And this is why. So it's more practical if we do something where they have a visual, like a picture or something that they can learn faster, because 80% of the time, 80% of the brain is involved in visual processing, which means when we show someone a picture, it is more likely that they will see it, memorize it quicker versus me talking to them for a very lengthy period of time. Which is wondering, I'm wondering if maybe that's why we try to be creative with PowerPoints. I wish I could have presented a PowerPoint with many more bells and whistles where I could keep your attention maybe for a longer period of time. Um, but we're only limited as to, I guess, how creative we are. So, for that being said, let's talk about the children. So, children, if I'm saying, let's go ahead and teach them something that they can take quickly, that they find interesting, and then they run with it. I am giving you an example developmentally. Developmentally, children, we could talk about children as young as 5 years of age up to high school, and that could be up to 18. At Denton ISD, while I was there, I remember when it was so fascinated when we learned something that really helped us understand how to speak to our students more about the brain. And it was something that really helped us all find a way to take out the mystery as to when speaking to children and adolescent about their brain, we wanted to take out the mystery and give them something visual, something quick and easy for them to capture the importance of our brain. So I will do something a little quick to kind of give you an idea of, and many of you may have already learned this, and I apologize if you're having to hear it again. But for those of you that have never seen this, let me just show you what we did. And it has been outstanding to now find out that there are children as young as 5 or 6 or up to high school level learning how to do some exercises to regulate themselves. So Dr. Dan Siegel is someone who created a hand model of the brain. And what he did was he wanted to teach us how to speak about the brain without making it so complicated. So I'm going to give you an idea, an illustration. If you open your palm facing out, this is what happens. If you fold your thumb in right here, and then you close your fingers down. This is a hand simulation of your brain, and I'll explain how. This is the spinal cord. This is the limbic system right here with the amygdala. The amygdala is where our brain detects, and boy, it's a powerful part of our brain with the limbic system right here. It detects when we feel anything, whether it's a sound, a smell, whatever we may see that makes us frightened and worried. Sometimes even to the point where we want to fly and run out of there. It's right here. The limbic system and the amygdala, but it's protected by the cortex. So if you look at this, my fingers right here, it's like you're looking at my forehead. So right behind my forehead is where you will find the intellectual part of my deep thoughts and how I make decisions right here, right there. But the amygdala is being protected for me not to have it out in the open. So when I experience fear or anger or worry, anxiety, this is what we taught the children through this model. They flip their lid. So the amygdala is left uncovered and they need to regulate. In order to regulate and to feel better, we must find a way so they can flip their lid back and they find comfort again. So some children even know now to say, you know what, Miss So and so, Tommy's bothering me. I'm not feeling great. I'm getting angry. I'm feeling like I'm going to flip my lid. Can I take a little break? They know that they're about to experience some anxiety and some very difficult things that they don't want to have to address on the way that they feel. So I will talk a little bit later about how they regulate that. So they flip their lid by bringing it down and they're back. That's one way of giving a visual and giving a tool to a child or an adolescent on how to perceive that their brain, although they don't see it, and it grows to be up to 3 pounds, and it's in a dark place, encased in a skull, it's nothing to be feared. It's actually a fascinating part of their whole being. And the more we learn about it, we learn how to help ourselves, especially if we're experiencing anxiety. So, a little bit more, we go into this portion where when I was reading and preparing for you, I wanted to gather some more in depth information because I wanted to simplify what I was looking at. So, yes, we see the brain development. We know that the brain is a very important organ in our body. We know the capacity that it has in the sense that we have only begun to scratch the surface. Yes, our babies need to be held. Why? Because our babies need to learn the balance, the coordination. We need to expose them to light in areas because their visual capacity is also developing. We need to speak to our babies. We need to touch and hold our babies. Why? Because they're learning language. They're also learning how to cope with emotion and feelings and thought. And not only that, we know that they don't make the wisest decisions at this age when they're little or teenagers. And that's because the frontal cortex, which the prefrontal cortex, which is what I was sharing with you right here at the front, that's where it doesn't become fully developed until the age of 25. So that's a lot of information. And I wanted to go in a way where I could share with you something that has been shared with us just recently. And if you are familiar with Dr. Brene Brown, she is a social worker. She is a researcher, and she has a podcast. She was interviewing Dr. David Eagleman, who is a neuroscientist, many years of research regarding the brain, and also the author of Live Wired, the inside story of the ever changing brain. And it was fascinating. If you get a chance to listen to her podcast and her interview of David Eagleman, Dr. David Eagleman, I would highly recommend it. And I'm going to give you the summary of what they discussed. Our brains, as much as we would like to believe that our brains are like a computer, like the software and the hardware, they have found that it is nothing like that whatsoever. Nothing. It is so more complex that a computer software or hardware comes nothing close to what the brain is like. The brain is so malleable, and they used to say the term plasticity. The brain is so malleable. Instead of plasticity, they use that term now because it experiences the brain when challenged with by giving our brain information. Remember, I was sharing with you that our children learn many things at school, or we are currently right now learning from each other. We are challenging our brain. And while we are doing that, the brain is so malleable and it will be slightly different and this is neurologically. The brain will be slightly different from when we started, whatever that may be. In this case, let me just repeat that. It's not because I am a very highly intelligent woman and I'm trying to say that that's who I am. No, nothing like that. It's only that I am sharing. I am the messenger, and I am sharing with you information about some of the research that has been conducted, some of the information that has been shared with us, either through articles or journals or podcasts. Podcasts like from people that are researchers and have the experience to share with us their knowledge. When we expose our brains to learn something new, our brain is actually changing, developing, and does not cease to learn. That is what I wanted to share with you. What we see on this slide is so important because, in reference to anxiety, if we would like to share with our youth or with our loved ones some techniques, some skills on how to cope with their anxiety, the brain can learn how to address, how to deal with that anxiety, because the brain is actually what causes the anxiety. It's in our brain. So that's important for us to keep in mind as we move forward to the next part of the presentation. You may be asking yourself, okay, so what can I do? If you're the parent, if you're, again, the instructor, if you're the friend, what can you do? A lot. Remember, if you put yourself in someone's shoes, you want someone to understand you. If we need empathy, we need someone to know and not judge. It's hard being a kid in this world right now, but not just right now. It's always been hard. We're just different in a different time. We'll talk a little bit about why it's so different now. They actually, kids, they need, they don't need answers. They need to hear from us. They need to be heard. We need to encourage healthy conversations where they can talk about what's going on. We don't need to judge them and make them believe like what they're sharing with us is debatable. We also need to share with them some of the negative side effects or roles that technology plays on our life. Our children spend so much time with their devices that it's not uncommon now for us to see tiny ones. As soon as they can hold up the phone, they're already spending time with the device. But once they start navigating and they start Googling and they start going into those areas where many times who's doing the supervision, you may or may not know, they're getting access to so much information. And some of that information may not even be accurate, but nonetheless, those opinions, that social media, all of that can create some anxiety for them. In my time, if I wanted to learn about something new that was going on in the community or somewhere else, I often had to read a newspaper or watch television. I don't know. I noticed that less and less children are watching shows. They watch YouTubes and they stream a lot of things that they watch on cable or other YouTube videos. Last but not least, let's make some referrals that are appropriate for those children that may be needing to see whether it's their counselor, whether it's the social worker, that person who's on your campus, or mom, dad, maybe their pediatrician, someone who can have that discussion with you to see if they can do an assessment to determine if there's another level of care that they may be needing. Oftentimes, let's face it, in a school setting, there's limited time for everyone. They may be able to see Susie, but not be able to do what we cannot do in a school setting, which is a formal assessment. They may be able to give you a list of referrals or resources, but as a parent or guardian, follow through. Go ahead and let your child know this is not because I think you're sick. It's because I think maybe there's some help available and you can start feeling better. Let's go find out. Coping skills. So, coping skills can be various ways, and we will go ahead and discuss about these coping skills as I move forward. But I would like to go ahead before I go and jump into depth about these coping skills. Is that some of these coping skills will be conscious, direct approach to problems. Some of them will be to serve or regulate physiological response or emotions back to a level which one can function properly. And then more effectively used in the preparation action in maintenance stages of change. What is that? Well, let's go ahead and go and move forward, okay? I will show you what that is in a little second. The age appropriate interventions that we will discuss have to do with promoting self awareness. The coping skills that we will discuss are reframing, grounding, and mindfulness. Here it is. So, the stage of change. When you have a kiddo or you have your child or loved one that you are trying to see if you can help because you notice that they are needing some interventions, um, here is a stage model that helps us understand where your student or child may be as far as the stage of change. Where are they at? And I'll break it down for you in just a second. First, identifying the stage of change will help decide what type of intervention will be most appropriate and beneficial for the adolescent. And then this also allows the adolescent to see and become familiar with their current mental state as it relates to change. So, in the next slide, here are the definitions, but I want you to look at the model right here because it just makes in my opinion, it makes more sense when you look at it. Okay. So, number one, pre-contemplation. So, think of a student or a child who has no clue, even though you observe all those symptoms and you definitely know that there's something that you consider to be somewhat some of those flags or symptoms of anxiety. But the child or the adolescent says, there's nothing wrong with me. They genuinely believe there is absolutely nothing wrong. They're in pre-contemplation stage. I don't have a problem. I don't know what you're talking about. I'm not sure why my coach sent me to talk to you here. I'm just trying to make the baseball team. I'm a pitcher. I'm a catcher, or I'm trying to make the band. I'm just trying to do me. I've got a lot on my plate. Can I go? They are not at all thinking that they have a problem within relation to possibly some symptoms of anxiety or possibly another problem. Number two, contemplation. Hmm. That's when your student maybe is going like, think of when you have a little angel and then that little devil on the left or vice versa. And this is the student or the person who's like, gee, they're not telling you, they're telling themselves. Well, my coach said I needed to talk to my counselor. My counselor's already talked to me. Gee, my friend tells me that I've been a little agitated. I'm not myself lately. Could it be? No. They're debating. They're not really sure, but they're already thinking, too many people or different situations, and it's been brought to my attention. Mom and dad, they keep telling me they won't leave me alone. That's the contemplation. Now, number three, preparation. I think it'll be simpler to say this is where they start prepping. This is where they start Googling, they start researching or looking at TikTok videos, and they're like, oh, that's me. That's what I'm going through. The preparation means that they're beginning to start getting ready to have that aha moment. Maybe I do need a little bit of help, but I'm not really sure. I'm not really sure how to go about it. Let me go back to my counselor or let me go talk to my coach. Hey, coach, you know what? You're right. I really haven't been myself. I just haven't been sleeping well. Or, Miss So and so, thank you. Thank you for my past. Can I go see my counselor? And when the counselor meets with the student, guess what? Because they already are in that preparation and they're wanting to make a change, step four is where you are at and there's action. That's when you start saying, okay, Johnny, let's talk about some of those skills that you can learn on how to help yourself when you're experiencing that. What exactly has been going on? And you can go ahead and start discussing what type of an intervention you are going to share with your student. And when I say intervention, please don't think that I'm saying we become all gung ho and all of us are therapists overnight and you have to do this and do that. No, it just means what help, what skill that you will be learning about, or you may already know, will you share with Johnny so when he's experiencing that, he can practice it and he may start feeling better. Number five, well, that's maintenance. That's where he or she continues to do, whether it's the breathing exercise, whether it's the mindfulness, whether it's the grounding, whatever helps, they learn to detect it quicker, better. Remember what I said about even a 5-year-old going, Miss So and so, can I take a break? Because I'm beginning to feel like my lid is going to flip. They also learn. Adolescent are very smart too. They also start to learn and they learn how to verbalize what they are experiencing. And parents, please, by all means, as I mentioned, and I cannot stress it enough, if you need to take your child or adolescent to your pediatrician and also find out through them through a formal assessment, if you're needing to do a little bit more, they will help you. They would be more than happy to assist with that. So, the definitions, I broke down the definitions, so we will go ahead and move forward. Promoting self awareness. The golden rule in therapy is as follows: know thyself. Why? Because when you get to know yourself, you know how to advocate for yourself on what you're needing. And this is some area where we will all learn that if we're experiencing something within reference to mental health regarding anxiety, it's good for us to know. This can be relatively surface level questioning. Let's start finding out. Let's try to help identify what are the triggers, what are the stressors, what is something that is causing my anxiety or other emotional responses. Now, you may not get a clear answer because that will take time. And oftentimes, what you will experience is the amygdala, it's exposed, and you don't even know what caused it. So don't be discouraged that oftentimes you may not know what your trigger is. You just may know that, I don't know, a certain location triggered it, a certain smell, a certain person, or what was said. It could be various things, and that will take time, but with effort and with help, you will get there. The important thing is that the brain can be retrained and it will learn how to better regulate those situations. Trying to identify warning signs or other patterns that tend to be repetitive, and helping to brainstorm why things are the way they are. And let's problem solve. The 5 direct physiological responses to anxiety are tempered breathing, increased blood pressure, increased heart rate, increased body temperature, and racing thoughts. Wow, it does, it's draining. So for the fight or flight, the threat system, those are when your thoughts are racing, and it helps us to evaluate threat quickly and make rapid decisions. But it is hard to focus on anything but the feeling of danger. As I mentioned, there is absolutely nothing wrong with that. It is there. It is there to protect us. Luckily, we don't even have to think about it. It has been said through research, they have found that in less than a tenth of a second, our body reacts to danger instantly. And there are times when you may not even know how that even happened. People have, for example, been in dangerous situations and they have, without even thinking, taken someone away from that situation. But when thinking back or looking back, do not even realize how and how quickly it happened. They just know they did it. So that is the reaction that our body has. There is change in vision. We have tunnel vision when we're experiencing a threat and we're feeling threatened. Our heart beats faster, our hands get cold, and that's because our blood vessels contract to force blood to major muscle organs. That blood needs to get to our muscles in case we need to start running. The muscles tense and they're ready to fight or run away. They may also shake or tremble. We get dizzy or lightheaded. The breathing becomes quicker, shallower to take in more oxygen. And that's for our body to have that oxygen so we can run away. The adrenaline glands release adrenaline. And that's something that we need in our organs if we're going to be fighting. There is the bladder urgency muscle in the bladder relax and it responds to stress. The palms become sweaty. Have you ever noticed that when you're nervous or you're scared, the palms become sweaty? And that's because the body sweats to keep cool. And this makes it more efficient as a machine. So let's talk about reframing. Wow. When our kiddos are experiencing so much, or us as adults are experiencing anxiety, one tactic or one way that is a coping skill that may help is called reframing. And this is something that we have taught ourselves, maybe not by looking at this visual, but by speaking to each other to say, it's all on the way you perceive something. If you change your perception regarding something, if you change it from a negative perception to a positive perception, the outcome could be so much nicer. Uh, let's be optimistic, and not be thinking that everything is always doomed. Here's a reframing tactic, a process of reconceptualizing a problem by seeing it different from a different perspective. This is something, alerting the conceptual of emotional context of a problem often serves to alter perceptions of the problem difficulty and to open up possibilities for solving it. For example, let's say I'm nervous to give a wrong answer in front of you. And I start saying to myself, like, you know, how we started out and I was having difficulty and I could feel my heart racing and I could feel that I was beginning to sweat. My mouth got dry. And I was beginning to feel very self conscious that I was letting you down because I should have been more prepared to share that PowerPoint a little bit quicker. But here I was trying to navigate it and not give myself so much into that feeling of negativity. If I'm nervous that I answer wrong, they will think I'm stupid. Or if I answer wrong, they will think I'm not intelligent. Or the teacher will embarrass me. If I get that answer wrong, uh, I'll get made fun of. Luckily, and I will say, and I'll be honest with you, luckily, I was able to say to myself, everyone has been so kind to join us this evening for this presentation. They have in them some patience to see me and watch me go through to try to navigate to bring back the presentation. In the back of my mind, and I'll be honest with you, it is true what I have learned over the years. I learned somewhere, someone explained to me that when in crisis, we go to our first language. You didn't hear me, but I was speaking to myself in Spanish. I was speaking to myself in Spanish, and it was all here because I felt that I was in a jam. When I reframed it and said to myself, they are listening, they are being patient, and they're so kind to have joined us. They will watch me navigate, and hopefully, very quickly, I can get us back on. That was my reframing of something that started out negative, and then I reframed it into something positive. It's no different. The reframing of this person saying that they're embarrassed if they get the answer wrong and everyone's going to think they're stupid is, I'm nervous to give a wrong answer in front of my peers. Could be anything else, okay? But if I do, I'm brave. But if I do, I'm proud of myself for trying. And if I do, I can learn from my mistakes. And then another act would be it's good to get out of my comfort zone. And I would agree. It's good for us to get out of our comfort zone. Grounding techniques. So, body awareness techniques that bring the here and now by directing focus to sensations to the body. So, what if you want to try something a little different and something that age appropriate? You can also say this for a grounding technique for someone who's experiencing that anxiety. Take 5 long, deep breaths through your nose and exhale through your puckered lips. 5 long, deep breaths to your nose, through your nose. Or place both feet on the floor. Wiggle your toes. Curl and uncurl toes several times. Spend a moment noticing the sensations in your feet. Another technique would be clench your hands into fists, then release the tension. Repeat 10 times. Another one would be press your palms together, press them harder, and hold this pose for 15 seconds. Pay attention to the feeling of tension in your hands and arms. Here's another one. Rub your palms together briskly. Notice the sound and the feeling of warmth. Or another one. Reach your hands over your head like you're trying to reach for the sky. Stretch like this for 5 seconds. 1, 2, 3, 4, 5. Bring your arms down and let them relax at your sides. Or take 5 more deep breaths and notice the calm in your body. A grounding technique for a mental exercise takes mind off uncomfortable thoughts and feelings, and they are discreet and easy to use at nearly any time and place. You can ask your student or child, name all the objects you see. Let them scan the room and start naming the objects that they see. Takes away the focus from the anxiety, and they are able to focus on the objects, and they gain their composure back. Describe the steps in performing an activity that you do well. And that could be anything, whether it's a sport or their favorite meal, how they would prepare it. They can count backwards. They can also pick up objects and describe them in detail, whether it's color, texture, size, weight, scent, other things that they notice. They can also spell names or the names of loved ones. You may even ask them to spell them backwards. It takes away the focus from the feeling of anxiety. And there are many other things like think of an object and draw it in your mind. And it could be something like try drawing your home or vehicle or an animal. Mindfulness. Mindfulness interventions. What is mindfulness? According to John Kabat-Zinn, it means paying attention in a particular way, on purpose, in the present moment, and non-judgmentally. So we become aware of what's happening as it is, again and again and again. And that could be something as simple as maybe you ask your student, did you bring your water bottle? Where's your water bottle? It's in your backpack. Feel free to take it out. You can drink some bottle. You can drink some water. Allow them to have some water and become more in tune with the present, where they are, before you even start discussing what brought them in. Journaling. That also is something that creates the opportunity to make lists and to also give them opportunities to be grateful for what is life. A mindfulness walk is also another way, or it involves checking in with yourself to see what your mind, body, and spirit need to cope or maintain positive well being. Last but not least, sleep hygiene. We cannot stress it enough. And I know I'm preaching to the choir, but these devices deprive so many of our youth. Many of them report that they even sleep with them all night. Every time they receive a notification, although they're sleeping, their brain, their body, they're feeling the vibration. The light that it has also, it keeps them alert. So poor sleep has detrimental effects on human brain and in turn our ability to regulate emotion. When we go without sleep or have continuous disrupted sleep, we are making it more likely that our amygdala, remember the amygdala, will be reactive and cause anxiety, other emotional reactions such as anger or irritability. Why? Because it flips. The lid is flipped and it's exposed. To calm anxiety, we need to resist influences that interfere with sleep. Techniques to improve the sleep hygiene: create a bedtime routine to follow each night. Eliminate the light stimulation for at least 1 hour before bed. Exercise during the day. Avoid napping. Establish consistent sleep and wake times. Near bedtime, replace activating thoughts with relaxing ones. That takes practice. Ensure your sleeping is in a conducive environment. Avoid caffeine, alcohol, spicy food in late afternoons and evening. Use relaxing breathing techniques before bed. Use your bed primarily for sleep instead of working or doing your homework. Avoid using sleep aids. Don't use backlit electronics 60 minutes prior to bed, as the artificial light prevents hormones in neurons that promote sleep. Okay. I wanted to end by saying that please know this, that we need to celebrate every opportunity we get, those little steps of advancement that we experience with our loved ones when they start to um, give us the opportunity to address that they are needing possibly some help. And when we start noticing that they are ready to implement a change, and we notice that they are putting in practice what they are learning, let's celebrate. Let's celebrate those small steps and little milestones that they're encountering. When we have interventions and we practice these interventions, it does not mean that anxiety will cease to exist. Because remember, anxiety is still something natural that is there to protect us from danger or imminent threat. But in order for us to know that our little ones or our loved ones are feeling better and are not going unregulated and on a constant, very exhausting way of living by constantly being vigilant because their lids are flipped, in order for us to know that they are doing better, we must continue to be willing not only to learn more about how to help them cope with their anxiety, but also, if needed, help them reach the intervention that they may be needing. And if that is required by going to their pediatrician, after you have spoken to them and they have also been speaking to their counselor, their intervention counselor, or maybe their teachers, together, all of us together, we can do what we strive to do at Connections, which is connecting you back to what matters most.